Thank you. Hello, everybody, and thank you for giving us this opportunity to present our product, Neuro. I'm Vinayak from Yosta Labs. We are a medtech startup based out of Bangalore, working on accessible and affordable healthcare. And let me start with some numbers. We have 73 million diabetic patients in India, and 30% of them are at risk of peripheral neuropathy. And every 3 minutes, a leg is lost somewhere in India because of diabetes. This amounts to around 2 lakh amputations per year in India. As we all know, neuropathy is one of the complications of diabetes, wherein it's a damage caused to the nerves by diabetes. Just a bit of numbers again. We see that out of the 73 million diabetic patients, applying the 50-50 rule, only 16 million of the diabetic patients seek treatment. And now, where are these patients going? If you look at the typical patient journey for the diabetic patients with neuropathy, the patient is going to the GP or the diabetologist, and where the screening may or may not happen for symptoms of neuropathy. The patient might get referred to a podiatric surgeon or a place where the foot screening is done, in the best case. And in the worst case, the patient has an amputation and he goes to the surgeon. And maybe he gets referred to the podiatric surgeon. And of course, the endocrinologist as well. The patient can either go to the GP or the diabetologist or the endocrinologist. Now, looking at the hospitals or the clinical superiority versus accessibility of our current healthcare setup, we have the GPs which have the maximum number of patient footfall, where the accessibility is easy, whereas the clinical superiority when it comes to foot examination is low. It progresses up towards the hospital. Hospitals are the most difficult to access, whereas they have the best of the equipment for screening the foot. What are the current ways by which the foot is screened for symptoms of neuropathy? Currently, we use the Weinstein monofilament. It's a 10-gram monofilament. We use the biaesthesiometer. We use the hot and cold perception test in some cases, and we have the skin infrared thermometer. The three for neuropathy and the skin infrared thermometer for vasculopathy. Now, what if we could combine all of this into a single handheld device and make the device available to the bottom half of this graph? What if we can get it outside of the hospital, more in the access of the diabetes specialist clinics, the diabetes clinics, and the GPs? So we worked on the device Neuro. Neuro is a portable device, point of care multi-parameter diagnostic device for peripheral neuropathy. Now, it is portable. It does not have any wires. It is a 4-in-1 test. It can do the VPT or the vibration perception test. It can perform the hot and the cold test. It can perform the monofilament test. In the monofilament test, it is digitized. It also has an infrared thermometer. It comes with a lithium-ion battery which lasts for 8 hours for every recharge, and it can be recharged using a simple micro USB cable. Now, it also comes with a Bluetooth which can transfer the data from the device onto a server which generates a test report. So, as you can see, it is a cloud-based report. The device is rechargeable and it can result in faster ROI. Just a bit about the device. The device is completely handheld. It's portable. It has the biaesthesiometer at the bottom end. It has the hot and cold test modules at the top. It has a monofilament at the front tip, and it has an infrared thermometer as well. In addition to this, it helps in generating a report, and the report is pretty self-explanatory. It has the test points where the test was performed. It also gives the values at those points, and it's color-coded to show which parts of the foot are at risk of neuropathy. With this, it's easy for the physician to explain to the patient the condition and prescribe prescribe the next steps of treatment, be it medicines or be it a better insole. We are a team of clinicians and engineers. We come with a collective experience of around 40 plus years. We have been supported by Wilgrow, and our partner hospitals are Manipal University, CMC Vellore, and Dr. Mohan's in Chennai. We have conducted a clinical validation of 1,200 subjects across Dr. Mohan's, CMC Vellore, and Manipal University. And we have currently deployed our device in Narayana Health as well. Yeah. Thank you. Any questions?
That was really quick.
Thank you.
That was really short and sweet. Thanks a lot. Thanks. We can take questions here. We have ample time.
So we are looking at a price range of 70,000 to 1 lakh, depending on the number of reports which will be given free with the device. So it would be a blended model where we'd be charging for the device, and the device would come with a set of free reports. Once the reports are exhausted, the reports would be charged. We see that since it's a battery operated device, we see that, nevertheless, it's a battery operated device, and like with all our mobile phones, we see that the batteries tend to age after 2 years. So we have an AMC, and we are looking at a replacement in case of any problems with the device, overnight replacement, and there is an AMC every year. We are yet to work on that. I'm sure it will be affordable.
Thank you, Dr. Vinayak.
Thank you, sir.